Victoria. That's 12 new cases since my update yesterday. 6 are linked to known outbreaks, 6 are under investigation by our public health team. I'm sad to say there are now 806 Victorians who've passed away because of this global pandemic. That is one more since yesterday, a male in his 80s, and that is linked to an aged care outbreak. We of course send our sympathies and condolences to that family. A total of 2,745,493 test results have been received since the beginning of the year. That is 11,994 test results since yesterday. Again, as we always do, thank you so much to that almost 12,000 Victorians who went and got tested the day before. It's so important. We've got to keep those numbers up, and we're deeply grateful to each and every one of those 12,000 people who went along and got tested. There are 32 healthcare workers who are active cases. We wish them well and we thank them and their colleagues for all of their hard work. The rolling averages to October 3 are Metro 11.9, Regional Victoria 0.2, cases classified as unknown source, so mystery cases across that period 18 September to 1 October. There are 13 in Metro Melbourne, none in Regional Victoria. The Metro Regional split, there is one, in today's numbers, there is one new case in Mitchell Shire. The Chief Health Officer can speak about that in just a moment. And there are just 3 active cases in Regional Victoria, including that one. Aged care active cases, there are 91 aged care cases that are active in aged care settings. That number continues to fall. It's very good news given the vulnerability of so many residents in aged care. There's only one active case in disability facility settings. That remains a staff member. That is pleasing as well for the same reason. And that is about all I needed to provide in terms of numbers of the day, other than to say today the weather is warm. It's not quite the day that yesterday was, and we would hope not to see quite the behaviour we saw Friday night, and in some instances a little bit yesterday. We've just got to stay the course on this. We're so close. Let's not any of us do anything that might undermine the very positive numbers, the very strong performance we've seen in recent days. The trend is with us. The numbers are coming down. Once we get them low, we can keep them low and we can open up again. And if you want to spend summer at the beach, then that'll be the time to do that. If we don't do anything silly, anything selfish right now. I want to thank all those Victorians who were going to the beach and did so in full accordance with the rules. All of those Victorians who went to the park, who followed the rules and were able to connect with others, were able to get some sunshine and some fresh air. Heavens knows Victorians have earned it, but it's got to be done in the right way. I think everybody gets that when they really take a moment to think about it. Let's not any of us do anything to jeopardise where we find ourselves. It's delicately poised, but we are there, ready. If we continue these numbers, continue this trend, we are ready to take that step, all things being equal, in just a couple of weeks' time. It's not too much for all of us just to see this thing through. That's the only option we have. If we try and shortcut this thing, then we'll be back where we were weeks and months ago. And it's a bit over 6 weeks ago that I wasn't standing up here reporting 12 cases. We're reporting 725 cases. You look around the world, look at Europe at the moment, and you see second waves are upon them or very close to it. This thing gets away very quickly. We want to avoid that, and that means everybody has to play their part. And I'm deeply grateful and very proud of all of those Victorians who are doing that, and that is the vast majority. We do focus on some of the poorer behaviour from time to time, and that's appropriate to a certain extent, but I wouldn't want a focus on that to take away from the amazing job that the vast majority of Victorians are doing. We are pleased to see these numbers trending the way that they are. We're on track with that adjusted timeline, about a week ahead of schedule, as we had indicated last weekend, and we've just all got to see this through. That's the most important thing. No one should be doing anything that potentially jeopardises everything that Victorians have given, everything that Victorians have fundamentally created, a set of circumstances that are so different to all of North America, large parts of Europe, large parts of Asia. We're in a very different position, and it's because of the hard work and the commitment and the absolute determination of Victorians to defeat this thing. Let's not any of us put that at risk. I'll now ask the Chief Health Officer to add to my comments, and then we're happy to take any questions you have.
Thanks, Premier. Certainly, just to reinforce, outdoor activities are actually fine if you do them safely. We know that we focused on rule breakers yesterday, but I've seen many examples of people doing absolutely the right thing, enjoying the outdoors. We know it's good for emotional well-being, psychological well-being, so it's important to get out. But the rules are no more than 2 households coming together and no more than 5 people, or indeed your entire household as a collective, and keeping your distance from other groups. There are many examples of people who are outdoors, enjoying their time in those groups under 5, and keeping a distance from others and wearing masks. Yes, the risk of transmission outdoors is less, but the whole point about limiting the number of households that you can interact with is that they are new contacts for you. They are still opportunities for transmission of the virus. That can still happen before you develop symptoms. And so limiting it, wearing masks and being outdoors are all important ways to make sure that that transmission doesn't occur, but sticking to the rules is a really important part of that. But congratulations to all of Melbourne who've done that, and I do hope you enjoy the outdoors in a safe way. So there is another regional case in Mitchell Shire. It's linked to the Butchers Club outbreak. It is a point to note that regional Victoria will remain at risk while there are still essential workers who need to move into regional Victoria and the close contacts that occur by virtue of that. So we have to be mindful of that. We're all trying to protect regional Victoria from any new cases, but we have to remember that regional Victorians still need to get tested if they're symptomatic, and they still need to be mindful of the ways that they can protect themselves, and for Melburnians who are going there, again, by physically distancing and by wearing masks, and of course, if you're unwell, to not be working, not be going anywhere, but getting tested and staying at home until that result is through. The numbers are a bit high today, but the trend is still on track. I would say, we're seeing it in the hospitalised cases. We've only got 1 patient in ICU on a ventilator. Only 3 in intensive care in total. I read a story from New York when it went through its March-April epidemic where, basically ENT specialists were running ICU patients because they were so overwhelmed. That's what we've avoided. We'll continue to avoid that, but that is what the potential is when cases get away from you. That's what Europe is probably facing in this second wave. They've got younger people being infected. They're less likely to require ICU, but the numbers now in second waves are sometimes orders of magnitude higher than they experienced in the first wave. So that will be a huge challenge for healthcare systems across the world as second waves start. So we need to be thankful for where we're at and to be mindful of the fact that we can keep it that way into the long term. That will be a struggle for many other countries around the world.
We're happy to take any questions you have.
Maybe just ask Brett, on the Butchers Club outbreak, how many cases now are linked to that in total, and how's this Mitchell Shire one connected?
There are now 20 cases linked to the Butcher Club at Chadstone Shopping Centre. That's 6 staff, 8 family members or household members, and 2 customers of the Butcher Club. And there are 4 other contacts comprising customers and staff who are present at the centre but not as yet, and maybe not easily identified as a link to the Butchers Club. But our suspicion would be, again, that there is probably a link there. The fact that we've only got 12 cases and we're identifying people who were at Chadstone at this time who are testing positive obviously gives us suspicion that they're linked in some way. And it might be, again, super spreaders or super spreading events where someone is particularly infectious and there's only casual contact, or there's only shared facilities like the public toilets in Chadstone that might have contributed to this transmission. So it's a salient lesson. Workplaces, essential workplaces will continue. People who work closely together can be part of a cluster, and all of their household contacts then become the secondary cases, and then the tertiary cases are where some of those household contacts go to their essential workplaces, again, before potentially they're symptomatic. So, the settings that we have in place now are really important. This is what happens with these settings. You can imagine if every retail place was open, every business was open, and people could move freely between a significant number of households without restrictions.
Are all of today's cases that have been linked to outbreaks linked to the Butcher Club, or are there other outbreaks?
No, I think there are other outbreaks that they're linked to, but there are 3 linked to the Butcher Club and 3 linked to Electra Park Medical Centre in Ashwood.
And just on the total number of active cases, I think it's the same as it was yesterday, today, and it's the first time that it hasn't fallen since August 15. Are you at all worried about that fall that we've seen since August stagnating a little bit?
Yeah, absolutely. I mean, I think obviously it'll be reflective of the fact that there were only a dozen cases that have completed their infectious period and are now no longer considered cases, and we've got 12 new ones. But we need to drive it down. I think we'll get there. We've got days before us and days ahead of us that'll be lower than 12, so that number of active cases will come down. The activity in aged care continues to drop, especially for residents. But staff as well, slowly but surely reduced numbers of cases. I should say mystery cases or cases of unknown origin remain a concern. We've got an uptick in the total number in the 14-day rolling period. There are 3 new mystery cases that have been identified or classified as of today. They're not in today's numbers, but they're postcodes 3145, 3023 and 3019. And for those who are not postcode literate like myself, that's 3145 East Melbourne, Caulfield East, 3023 is Carolyn Springs and Deer Park, and 3019 is Braybrook, so to the southeast and west of Metro Melbourne.
Just on the Butchers Club, the cluster there, does it have anything to do with the protests that we saw at Chadstone Shopping Centre over the past few weeks?
Look, we can't say. I don't think so. I think the likelihood is, knowing that there's been a cluster of cases at the Butcher Club and in an adjacent cafe, Jasper Coffee, means that there were opportunities for transmission there, and most people then become symptomatic 5 or 6 days after being exposed. So I think that's the likely link and the likely timeline. It's clearly not helpful to have people gathering anywhere where there's that potential, and that's why we keep reinforcing. Doesn't matter what the gathering is for, if it's breaking the rules, whether it's a protest, whether it's just a gathering that's breaking the directions for other reasons, we just don't want it to happen because of that risk.
And have you got one of these local health teams overseeing contact tracing and everything at the Butchers Club?
Yeah, absolutely. We are, the individual cases that we see have great complexity to them sometimes, and we're standing up incident management teams or outbreak management teams for those individual cases. That's how much we're chasing this down, and it's because there are complex links and there are dozens of close contacts and dozens of networks that need to be explored in order to manage that.
So is that being done locally, just to be clear?
Yeah, it's being done locally. There's obviously the central case contact and outbreak management team that provides direction and support to that, but a lot of the community engagement testing is facilitated by a local incident management team. And is it going well? Yeah, it is. It is going well. They are both aware of the issues at play locally. They know the stakeholders that they need to engage. And they are speaking to their community members and their representatives with that knowledge about what their needs are, what the messages should be, and how it should be transmitted.
One case today from the Butcher Club, as a customer or a staff member?
So a household member.
And the 32 healthcare workers, are they? Do you have a breakdown of whether they're aged care workers or
the active cases? Yeah. 17 aged care workers, 14 nursing staff, and 1 medical practitioner, which has kind of been the relative split right through. That there's an overwhelming majority that are aged care staff of whatever kind, and nursing staff making up the majority.
Do you have a breakdown of the 91 active cases in aged care?
Oh, you're just asking the tough questions, aren't you? No, I don't. I don't.
Professor Sutton, there's 3 active cases in regional Victoria. I assume on top of the Mitchell Shire one today, the other 2 are still Colac, Otway and East Gippsland?
Yes, East Gippsland and Mitchell Shire, as I understand it, the other 2.
How is it then able to justify the restrictions that remain in place in regional Victoria, given there's just 3 cases there?
So again, the settings that we have in regional Victoria really relate to what the transmission potential is if a new case were introduced there. If you have no restrictions, for example, and you know, it's not inconceivable that in the next week or 2, or a couple of weeks probably, that regional Victoria could have 1 or 2 active cases. But if the settings allow for dozens and dozens of interactions for anyone, then an infectious case has dozens and dozens of interactions, and that is what leads to that exponential growth in cases. Regional Victoria doesn't want to see that. None of us want to see that. So if we could absolutely isolate regional Victoria completely from Metro Melbourne, then maybe we could have settings that that really allow much more freedom of interaction. But while there's essential work, while there are those interactions with Metro Melbourne that must occur because of essential industries, then we have to have a kind of setting that minimises that potential. It doesn't take it away, as you've seen, but we have to minimise it.
Why can't individual regions be broken down the same way that Melbourne is broken down from everywhere
For that
else?
same reason, people will move across regional Victoria for essential reasons. And in a sense, if you were to create a region with no restrictions, what do you think that might mean for people
It's not
moving?
about no restrictions, it's about the level of restrictions.
Or
currently.
level of restrictions that are really appealing to people who haven't been able to do a number of things. You know, it might be indoor community sport. I can see that, you know, that could lead to people moving into those regions furtively to be able to enjoy some of that. Now that would be a risk to that region, just as they're enjoying it themselves. There would be a risk of seeding from other places that might have cases. So all of that needs to be kept in mind, I
The
think.
state of Victoria landmass size is 23 times the size of the Greater Melbourne region. Do you think it's justified to keep that entire region on the restrictions they are currently at when there are 3 active cases, albeit rather close to Melbourne?
Clearly we do. Like this is the setting that's been judged to protect regional Victoria, and lots of regional Victorians understand and desire that, and would not want it any other way. We know that it's tough for businesses. We know that it's tough for people who haven't been able to see family members and loved ones for a long period of time. But the alternative is to see a growth in numbers that just leads to greater restrictions. The judgments that are now being made about Victoria's border with South Australia and elsewhere are judgments that can only be made because we've got down to the number of active cases we have in regional Victoria. If that were to turn around, again, it's not for Victoria to make those decisions, but I can see other jurisdictions saying, well, that's not safe to open up with regional Victoria. So we need regional Victoria to be in a position where they can have that movement potentially across to other jurisdictions in Australia. WA has obviously made a judgment about not requiring a mandatory quarantine period in a hotel for Victoria. That's because of where we've gotten to.
There will be more movement around Melbourne this week with senior students going back. Any concerns around that, or are you comfortable?
Yeah, we're obviously moving slow and steady. The risk in primary school kids is less. We're really clear about that. As you get older, that risk transitions and you get to more adult-like transmission of illness. So we have to be aware of that, especially for year 11s and 12s. But overall, we just need to make sure that it's not just a case of back to normal at school, but all of those things that we've been working very closely with the Department of Education around, which is ventilation, making sure that anyone who's unwell, who has symptoms, doesn't come to school as teachers, as other staff or as students, that they're home getting tested, getting a result before they're coming back to school. All of the hand hygiene, all of the physical distancing to the extent that it can occur. and of course the mask for kids in senior school.
And do you think school, given what we saw at Altaqua College, the big outbreak linked to that, do you think schools understand what they need to be doing?
I think so. I think there's been lots of reflections from the early part of this wave, and in part the challenges at that point in time was that community transmission was increasing, and what the Murdoch Children's Research Institute research told us is that community transmission drives the cases in schools. It's not really the other way around. They don't necessarily amplify it. So we've gotten to a point where the levels of transmission in the community now are so low that makes schools really a very safe place to go. It does mean that you can still get a community case who turns up in school, but we've got really good program to minimise the risk of transmission within that school setting.
This might be one for the Premier, but where are we at on the return of years 7 to 10 in terms of working out what the timeline might be for that?
Rachel will have more to say about that soon. Obviously we want to give parents notice, but at the same time I think it's important to acknowledge that this is almost a constant theme all the way through all these different rules, is leaving a period of time between each of the phases so that we've got a sense of what impact that change has had. It is very good news to have our seniors back this week and to have all our primary school kids back next week. Special schools, we've done as much as we can at this point, but we'll have more to say quite soon to add to that and give families as much certainty as we possibly can.
Premier, on the hotel quarantine issue, are you aware that many of the 1,300 odd airline staff employed to run that are also getting JobKeeper?
I'd need to come back to you on the arrangements that are in place there.
We've had a few people come forward, airline staff who didn't apply for that role in hotel quarantine because they were scared of what happened after the first outbreak. Now they're sitting back watching their colleagues earn a lot more for effectively doing nothing. Is that fair?
Well, as I said to you, I'll need to come back to you in terms of what arrangements are in place.
On Friday, we learnt that one of the 9 workers who tested positive for coronavirus while working in hotel quarantine between July 27 and the end of August had been working shifts at an aged care facility and at the Grand Chancellor Hotel. On the 2nd of August, we went into stage 4 restrictions. You shut down entire industries to limit the spread of coronavirus, and yet we had a government subcontracted worker who was working in the setting that had caused Victoria's second wave and moving between that setting and aged care, which to date has been linked to 640 deaths. Why on earth was that happening?
Well, I'm not sure that the person worked any shifts in aged care while they were infectious.
DHHS I don't know about being infectious, no.
Which is the key.
Confirmed on Friday that they were moving between those settings.
Well, again, I'd need to come back to you in terms of the further details about that particular case. But the key point there is, as Brett made the point yesterday or the day before, I think, and the attorney as well, we're doing everything we can to limit movement. Sometimes you can't get 100%, you can't reduce that to 0. But the key point there is whether the person was infectious. I don't have that detail.
But if you can't even limit, this person was working on a government subcontracted... At
a hotel with no one returning from overseas. This was emergency accommodation for people who had voluntarily decided that they had taken up an offer to go and isolate, not in their home. That's one case. I'm more than happy to chase it up, Rachel. I don't have a timeline or a sequence about whether that person was infectious. But the program's been and being reset. That doesn't happen overnight, and I dare say that in any workforce there will always be, even despite some pretty concerted efforts, there may well be a very small number of people who, for a period of time, not ongoing, but for a period of time, may have worked in their own transition period, if you like, their own reset. They may have worked at more than one place.
This was happening though at a point where you told hundreds of thousands of Victorians that they couldn't go to work because we were trying to limit the spread of coronavirus.
Yeah, I'm fully aware.
In hotel quarantine, a government project, we had someone who was moving from hotel quarantine to aged care. Why was that?
I don't know how many times they did that. I don't know whether they were infectious. I don't know. That's not a feature of the program now. Weeks and months later, I don't have the file note in front of me. I can't give you any further information, but I wouldn't draw the point I wouldn't make the point you're making. Hundreds of thousands of people were sent home, absolutely, and now 127,000 of them are back at work because of the decision we took to get the case numbers down. I'm fully aware of the rules we put in place and the decisions we made, and that's exactly why we've got 12 cases today, not 725.
Do you have safeguards in place now to ensure that no one who's working in hotel quarantine
That's
is
my
moving
understanding,
between that setting and other sensitive settings?
That's my understanding, and I think that the Attorney General and the Corrections Commissioner spoke to those issues on Thursday or Friday, whenever that was, when we had quite a lengthy discussion about that. If there's anything further I can add, then I'm more than happy to have one of them come back to you.
And why, given that we knew when you announced the inquiry at the end of June that we'd had these problems in hotel quarantine, has it taken until now to put those safeguards in place?
I don't think it's a recent thing. I think it's been there for quite some time.
It clearly
And
wasn't,
indeed,
6
but
weeks
hang on,
after
Rachel. You're quoting
June,
you're quoting me an example from August.
Yeah,
it's
which was-
October now,
which was-
so the
which was
notion
6
I'm not.
weeks after June.
Yeah, and about 6 weeks ago. So, again, for you to infer that it's recent, I don't think is accurate. But again, we're probably both at a bit of a disadvantage because I don't have the sequence of what occurred. I don't have the note in front of me. I've committed to you that I'll chase up any additional information that there is, and then we'll get that to you.
Just
What
back
if you
on,
know?
sorry, can I just stick with the inquiry? Just back on the inquiry with regards to Graham Ashton's evidence at the inquiry and the 6 minutes between when he texted saying that he thought it was police who'd be used to guard hotels to then texting that he believed it would be private securities guarding hotels. Do you believe the inquiry should have access to his incoming phone records?
It's entirely a matter for the inquiry.
Do you believe that that would be beneficial to finding out who made the decision?
It's entirely about a matter for Judge Coate. I'm not going to be standing here telling them what they should and shouldn't do and what would be preferable and not preferable. They're an independent process. It was set up at arm's length from government, and they've got the budget they need, the powers they need. I don't think anyone could credibly make a claim that they hadn't looked at these matters thoroughly. But as far as trying to direct them or be a commentator on their work, I haven't done that, and I'm not going to do it now.
With the powers they need, though, do they have the powers to access phone records, incoming phone records?
Again, you'd have to speak to them about whether they have.
And they've certainly not come. They need. Should that be a power they have?
Well, they've certainly not come to me and asked for anything additional other than some additional funding, and we answered in the affirmative, and that additional funding was provided. Again, it's not a process that I'm running. It's a process that's being run independent, and it should be. Beyond that, you can invite me to comment on evidence get led by different witnesses. I'm not doing that. I'm going to wait for the final report, which is in just a few weeks.
And again, given how much it now has cost him, $6 million plus whatever the legal teams are for government departments, do you think if they don't find out that answer that they've done their job?
Well, again, I think you're asking me to talk about a report that has not yet been handed down, and I've been pretty consistent that I'm not going to do that. We'll wait and see the report, and we can read it. They'll come to all sorts of conclusions, no doubt. They'll have recommendations, findings, and I don't think any of us can predict what it is that they'll come up with. That's the nature of an independent process.
What do you know whether the COVID Safe app has helped track down anyone linked to the Butchers Club, given Chadstone, those sort of areas were...
Not that I know of yet.
No.
Isn't that what it was supposed to do? Is find people in those sort of settings?
Well, I've downloaded it. I hope you've downloaded it. I hope everyone downloads it. And the more people that download it, the more useful it'll be.
Not working though. If it can't find people,
I've been invited. I don't know how many times now to get into the app. I'm not interested in doing that. I'd rather spend my time and the time of our audience today and every day simply commending to every Victorian, please download the app. The more people that download it, the better it'll work.
Those flight attendants that are involved in hotel quarantine, are they still flying on the side, or are they completely banned from that?
As I said to you, I'll come back to you.
I think you said that yesterday with respect for...
Well, I could answer differently and make something up. No, I'll get you an answer, and my staff will come back to you. And I think that, thank you, thumbs up. The camera didn't get that, but there was a thumbs up. Thank you very much. It's important to acknowledge that my staff have a lot of things to do, and whenever I say we'll come back to you, we work as hard as we can to come back to you. And I'm very pleased with that approach, and I'm sure that they'll be happy to chase those things up for you today.
Yeah, we've had a few questions on the ABC blog about whether people in Melbourne can travel to regional Victoria to carry out fire preparation work.
We'll have more to say about that quite soon. The normal sort of fire action week is fast approaching. We don't want anyone to have their property at risk. We don't want anyone to not be able to do that, but it's got to be done safely. Minister Neville will have more to say about that quite soon. It's a point that's been raised with us consistently. A similar point about people who'd not been able to get to second residences for quite a lengthy period of time, and there might have been storm damage, there might have been, and therefore perhaps their insurance wouldn't cover them. We reached out to the Insurance Council of Australia and we've got a really good outcome there, I think. But we'll have more to say about that fire preparedness soon.
So safe to say, if you're watching this now, you should not go until you hear more from you.
That is the best thing to do, because what we're trying to do is limit movement. We're trying to limit the number of people from a high virus community, which is Melbourne, higher, to a very low virus community being regional Victoria. We don't want to see cases seeding and then running. So there'll be a time to do that. There is also very significant spring rain forecast. In fact, we've got warnings about flooding in broad terms. So I think this is a different spring to last year. I'd certainly hope it's a different summer to last summer. We'll get people in there to do that work, but it's got to be done at the appropriate time, and there'll be rules to follow, processes to follow, and as soon as we can update people on that, we will.
Given the crowds we've seen over the last few days with the warming weather, do you foresee the 5 kilometre or the 10 kilometre radius staying in place over the next few months just to limit the number of crowds at beaches or popular parks?
Oh, look, I can't put a timeline on it, but those rules serve a really important purpose, and they'll be in place for as long as that purpose is relevant and proportionate. The benefit is relevant and proportionate to the challenge that we face. So, again, there'll be a time when that can come off, but exactly when that is, or it might be extended, when that is, we can't be certain now. But we've tried to be as clear as we can each day, every day, with every Victorian. These rules are not there for any other reason than to keep people safe and to get us open. And we've already relaxed some rules. Regional Victoria's in a very different place today than they were three or four weeks ago. And hopefully on the 18th or 19th of October, so just in a couple of weeks' time, Metro Melbourne will be in a different place than they are right now, and certainly a very different place weeks and months after that. It needs to evolve in that safe and steady way, and we're really confident that it can.
And have you spoken to any of the Bayside councils about shutting down beaches or maybe limiting the number of people who are allowed on beaches?
I haven't spoken to them personally, but I understand that they're very focused on these issues, and I want to thank our partners in local government, particularly those Bayside councils, who I think were just as angry and just as disappointed as myself and the Chief Health Officer and the vast majority of Victorians when they saw those scenes on Friday night, and to a lesser extent, pleasingly to a lesser extent, yesterday.
Will there be more planning around future good weather weekends? Given what we saw Friday night, does there need to be a more coordinated approach perhaps to these weekends, given there's going to be more of them hopefully?
Yeah, I wouldn't say that that there wasn't a level of focus on this. I think there was, but it can be a bit challenging, if you like, to predict some of that behaviour. I was asked yesterday, how is it that people, thought this was a good thing to do? I don't think a lot of thought went into it, frankly. I think people have done the wrong thing. Hopefully we don't see more of that, but it would be unwise for anybody who is thinking about doing those sorts of things the next time we get a warm day. It just puts everything at risk, and it just essentially is it's completely wrong to essentially say to the rest of the Victorian community, I don't care what you've done, I don't care what you've given, what you've sacrificed, and I'll go and be as selfish as possible. That's just not right. Plus, Victoria Police are out there and they will fine you, and I wouldn't have thought that was something anyone wanted.
Is it challenging to predict that behaviour, or is it challenging to change it? Because surely it's just like
Well,
sunny day,
perhaps
go to
both.
the beach. It's not challenging to predict. It's easy to predict.
Perhaps both. Well, no, it's sunny, yes, and people love to go to the beach when it's sunny, but there's a global pandemic on, and we're very close to beating the second wave. So I'd ask people to, yes, there's a natural urge to go and spend time in the sun, but surely there's a greater urge to see this thing off, to defeat it, and to have a normal summer, and have a COVID normal Christmas and 2021 vastly different and better than the way 2020 has unfolded. Surely that's a greater greater urge. We're getting into a bit of psychology here. I'm not trained for that. You might be, but I think the key point here is this: stay the course. We're so close. We're so close. Let's not do silly things, selfish things that just hand it all back. That doesn't make any sense at all.
Do you have details on the 2 remaining suburban contact tracing hubs you're yet to announce?
Well, there might be more than 2. There might be more than 2, Samaya, but I don't have the answer for your question. But I won't come back to you on it. I don't need to. I'll be making an announcement about that very soon.
How soon? Like over the next?
Well, we're back where we've been in. We've done this. Yes,
I'm not
we've done this a few times. We've done this a few times. This is like anyway. We could turn this into a black and white film, actually. First base, second base, all this. I'll have announcents to make very soon, and I think you'll be very pleased. All Victorians will be pleased that we'll finish up, I think, having more than the 5, and they're a really important way, not just for now, but I think throughout the COVID normal period. And I've not had a direct conversation with the Chief Health Officer, but I think I'm pretty confident that he'd be very supportive of them staying in place once this pandemic is long gone, to potentially assist with a range of other things, whether it be Legionella, safe drinking water, food poisoning, issues of other notifiable viruses, all of those sorts of issues. So it's important now and may well have an enduring benefit.
Minister Molino last week said, I guess at the start of the second wave, particularly around Al Taqwa College, there were school outbreak hubs designed to contain the cluster at Al Taqwa.
Yep.
I guess, will that be a permanent feature, particularly during COVID, as in like school outbreak teams, meetworks?
Yes, exactly.
Yep.
And I think that was one of the things that we were able to share with New South Wales when the team went up there. There's an outbreak team that's they're a group of public health people, right? People who've got those skills. And then we embed within them people from the education department, people from other government departments who know that setting really well. And that served us well. So that'll continue to be a feature. So they're kind of specialised outbreak teams based on the learnings and the unique circumstances of, say, a meatworks versus a butcher shop in a great big shopping centre. So they're actually different.
And how many different sort of teams like that are there? There's education, meatworks.
There's
what
several.
Other settings?
There's several. We can get you some further detail on that. Yep. And they get stood up at that local level. So that's in addition to any local public health unit. An outbreak or an incident management team then comes in on top of that and then supplements that work and just works on that one outbreak, not anything else beyond that. Although it's often not just a matter of inside the shop or inside the setting. It's about community engagement, call to test, interviews, tracking down, mapping out all those links, which can be, as we know, they can be very, very complex, even from something that might appear to be quite a simple thing. It can finish up in Mitchell Shire just a couple of days later. And as you know, Chadstone's nowhere near Mitchell Shire.
And do you have any details, or has Alan Finkel provided the report to you based on his observations from New South Wales?
It was provided to National Cabinet. So its status is a matter for the National Cabinet.
Are you able to sort of walk us through some of the things, some of the learnings that you haven't previously touched on?
No, I think I've touched on most of the learnings. There was no great, bolt from the blue moment that came out of it. And again, no one should be surprised about that, because Brett's team has been talking with Kerry Chant's team for months. And they were doing some contact tracing for us when we were right at the peak. And I'm sure we've provided them with assistance from time to time as well, probably back during the first wave. If you think about all those Ruby Princess passengers who finished up coming to Melbourne, we were working together very, very, very closely. So I'm not surprised by that. Everyone's in a slightly different place, but that's where that National Cabinet decision to at least have, I'm not sure whether it'll be a program, but it'll be a facility where in a digital way you can reach in and get data from one state and share it with another state. And of course there's also the work that we're doing around our CRM product and the Defence Science product as well.
When's that program being implemented? The one where you can, I guess, data from
I can't tell you that. That'll be, I expect, because that's national obviously, I expect that'll be something that we'll probably talk about at the next National Cabinet meeting, I would think. At least in concept, how quickly it can be designed and how quickly you can build the the interoperability between separate systems, I think that's the report that's probably going to come back to us tomorrow.
Have you had any more discussions with the federal government about infrastructure in Tuesday's budget?
Yes, we have. We've been talking at length with Prime Minister's office. I think Minister Tudge and Jacinta, Minister Allen have been talking. Shepparton Line, Stage 3, Warrnambool Line, Stage 2, Murray Basin Rail Project. There's a closeout option for one of the options on that project. Barwon Heads Road, Narre North Road, South Road, Hall Road, Western Port Highway, Princess Highway West and East, and some other regional highway corridor upgrades. That's about a $1.75 billion package. It wouldn't all be federal money. There'd be some co-contributions from us. That's the bare minimum. There's probably some others that we've been talking about. In fact, there are some others that we've been talking about. And I'd be really confident that the Prime Minister will know and understand that if you want the national economy to be going well, then you've got to support the engine room of that national economy, which is the great state of Victoria.
Any indication whether they'll deliver on some of their election commitments, like, say, Rowville Rail, Glenferrie Road, level crossing, things like that, that they're clearly going to need your help with?
Well, you're right to point to the fact that they are commitments of the Commonwealth Government, and you probably have to speak to them about what their intentions there are. But look, the projects I've just listed are good for about 1,400 jobs, and good jobs. And we know a thing or two about these sort of jobs because we've created about 150,000 of them over the last six years. The last 6 years in our state has been all about getting on and getting things done and employing hundreds of thousands of people, TAFE qualified by and large. That's where the jobs are, and we thank those workers and their families for the amazing work that they've done. And when we deliver our budget, they'll have a lot more to do, It's going to be a very, very significant investment. I think the biggest investment our state's ever seen to set us up for the future. Not just recovery and repair, as important as that is, but it's about confidence, momentum. It's about that spark, that real sense of energy, that sense of that things are happening. And that'll be a feature, a big feature of the budget that we'll hand down.
Do you think the feds are under pressure on infrastructure, given they've got less than 2 years until they go to the polls?
Oh, look, you can comment on who's under political pressure and elections and all those sort of things. I'm not too focused on that. I just took issue yesterday with some statements that were just wrong. Were just completely and utterly wrong. And I don't think it's fair on the hundreds of thousands of Victorian workers who are out there pouring concrete, out there doing the best of work in unprecedented terms, to be essentially alleging that things aren't getting built in Victoria. Not only is it wrong, but I just think it's unfair on those workers who work 24/7. They work hard. And I've met, not all of them, but I've met many of them, as I make a habit of going and touring the dozens and dozens of construction sites that are part of our biggest build agenda ever. If anyone in the federal government would like a tour of those sites, I'll be more than happy to arrange it for them. COVID safe, of course. I'll be more than happy to arrange a tour for even the most senior members of the federal government. We can go and take them and show them what an infrastructure agenda looks like.
Do you think on grand final day that we might be in a position to allow bigger public gatherings or even pubs to watch the game?
I wish I could provide you with an answer to that question today. What I can say is that people will have a clearer picture once we get to the 18th and 19th, around that period, which is just a couple of weeks away. We'll be in a better position then to be able to give people a clearer sense of what that following weekend and indeed the weeks ahead will look like. If I could say it now, of course I would, but we just have to, much like the decisions we made and announced only last weekend, we've just got to see how these numbers continue. We've all got to keep doing everything we can to get those numbers down.
That date is 14 days away from tomorrow. Are you confident that that 14-day average can get down from 11.9 to 5 in just 2 weeks?
Well, as confident as you can be. You can't be certain. That's not the nature of this virus. But all of our modelling that's been run and rerun, inputs from multiple universities, multiple medical research institutes, Alan and his team have done, and Brett, the whole team have done a power of work, and they're confident that we're about a week ahead of schedule, which is why we went from roughly the 26th back to the 18th or 19th. And you know, this trend is with us. We just have to stay true to it and keep following these rules for just a couple of weeks, and then all the advice is that we have every chance that we can take a big step, not an unsafe step, not flick a switch to COVID normal and everything gets opened up all on one day, but some very significant steps then. And then hopefully, to the question in relation to people gathering for the grand final, hopefully we can finish up in a situation where we've got arrangements that are pretty close to what's happening in regional Victoria. There'll be a big focus on outdoors, but there may be some inside. We're just a bit too early for us to be able to say now, and I know that's very frustrating. People would love to know, and I'd love to be able to speak in completely clear terms about these things, but that's just not the enemy that we're up against.
Do you have a date for the Victorian budget?
As I've said to you a number of times, the Treasurer will make those announcements soon.
The Peninsula Hot Springs has reopened under the outdoor pool rules to people within 5Ks to book 2-hour slots. How is sitting around in a hot spring with a bunch of strangers having a soak, not cutting laps, any different to sitting around at a bar having a drink with a bunch of strangers?
I'm not aware that the Peninsula, I'm aware of the business, but I'm not expert in these matters. The Chief Health Officer might want to speak to that, or we may come back to you. I'm not entirely sure exactly what they're doing, the booking arrangements and things of that nature, and that may well have a bearing on it, together with cleaning and all sorts of other things. I don't know whether Brett wanted to add anything to that.
On the issue with opening pools is that it is an outdoor setting. They are 18, 20 times less risky in terms of transmission than indoor settings. We will get to pubs opening in a COVID-safe way at the right time, but there's a volume of people that would apply to, millions, and this is about a small number of bookings within a 5K area that applies to other outdoor pools that we regard as safe, with COVID restrictions in place as well in terms of the caps on numbers and all of the other procedures they have to go through from a hygiene point of view.
Just on the suburban contact tracing hubs, the Premier obviously indicated it'd be a permanent feature of our public health team in Victoria. What does that actually mean, and why is that a good thing?
Look, it's a really critical evolution. I've been an advocate for decentralised health protection or public health functions for a long time. The engagement with local partners is a really critical one. You understand what the issues are when you're connected to those local communities and the local community health centres and other stakeholders. The ability to understand that on-the-ground intelligence is much greater. And the agility and flexibility, as well as the surge capability, because you've got those in place ongoing, is much greater. It's an opportunity to build experience and to build the kind of credentials for public health that will be an asset right through. As the Premier said, they'll be COVID focused for a period of time. There's an opportunity to expand to all of our notifiable communicable diseases, of which there are 70 plus. And there's a potential opportunity to go to the broader issues of health protection, food safety, environmental health, that brings in Legionnaire's disease, foodborne outbreaks and the like. There's even an opportunity to have the most fulsome public health functions, which goes to population health, tobacco control, physical activity, obesity, whatever it might be. So I think we're designing with a COVID focus at the moment, but absolutely in mind to the full functions of health protection or public health down the track.
And why was there a need to expand it to have more than 5 suburban contact tracing hubs? I guess, how did you arrive to that decision over the last week or two?
Look, I think we're reflecting on getting a good coverage for Metropolitan Melbourne. They're geographically housed with health services, but they're absolutely community focused, and they should and must be community health led, primary care led in terms of their operations. But the kind of health services clusters that have been a part of our COVID response is a nice way to get that geographic spread across Metro Melbourne. And from my point of view, I'm not going to argue against greater numbers than lesser numbers in terms of that surge capability and the opportunity for a public health and ID workforce to be able to engage in all of that work and learn over time.
And as part of your internal modelling, as we go towards COVID normal, enter the later stages of summer where the weather gets hot, have you been inputting data into your softwares that reflects the crowds we saw over the last few days?
Certainly the policy settings are put in as assumptions into all of that modelling. There is a consideration about what levels of compliance happen with those settings, and with an understanding that it won't be the same week on week over time. So yes, that's accounted for. That they're pretty difficult predictions to make. You make assumptions on a best guess, but you also try and follow what you know from the data over time, because we do have that data around people's self-reported compliance, willingness to comply, motivation to comply. So all of those things are inputted appropriately.
And when you do input those crowds and the assumptions, does that reveal anything different in regards to our roadmap and whether we can achieve COVID normal by the end of the year?
Oh, it's certainly given us those thresholds and those timelines. So yes, that's what the modelling is telling us. Alan's spoken to the fact that it's very fragile in the sense that a significant outbreak, when you get down to the last 20, 30, 50 cases, it's all dependent on who those 50 people are and how they're behaving and what their connections are. So the modelling can only tell you a kind of map on the path, but it can't tell you exactly what it'll look like when you get there.
Can I ask how you think we get from 11.9 down to 5 in 2 weeks?
Look, we have to see how it pans out. Obviously, some of the numbers on a daily basis have clearly been driven by our existing clusters and outbreaks. If we can get really good control of those in the next few days, limit further close contacts, and make sure that everyone who's a close contact is quarantined and safe, then those numbers come off our future daily numbers. So instead of 12, and with 6 linked to outbreaks and clusters today, we should see 6. And even those 6 are being driven down as there's more and more control in our aged care settings. And look, there are 48 active aged care outbreaks, so there's potential there for lots of new cases. But the fact that we're only seeing a couple a day out of those settings means that there's more and more control across all of those settings. A lot of them are coming to the end of their active period where they're closed off, and there's no longer a risk of further transmission.
You mentioned 3 new unknown cases in recent days. How concerned are you about that? And will they just have dropped off when we get to October the 19th?
That's right. So the 14-day rolling period, when we get to October 19, we'll go back to the 14 days prior. So that's starting in the next couple of days. But those mystery cases are always a concern. They may, one single case of unknown acquisition, we don't know what it represents, but it might represent 5 true cases out there. It might represent 10 or 15 true cases out there, because we don't know where they got it from. It means that there's someone else out there who's given it to them, and potentially given it to others who have very mild illness or asymptomatic, or who haven't presented for care or for testing. So we're focused on it, and the reason I listed those postcodes is it's really a call to arms for anyone in those postcodes. Of course it applies across Victoria, but anyone in those postcodes should be aware that there's transmission in those postcodes. They should really think about whether they're symptomatic and get tested to protect themselves with early diagnosis and management, and protect their loved ones and their families.
On aged care, you've described what we know about the aged care settings at the moment. Would you describe the way the cases are moving there as under control, given what we know?
Yeah, they're under control. Again, there's a fragility there because every single new case needs to be doing the right thing, testing as soon as they've got symptoms, and isolating if they're working in those settings. There's a real awareness now for everyone who's working in an active outbreak to look out for residents who present newly with symptoms, and of course for any of those staff members who develop symptoms to be isolating testing. So that's happening, and that gives you a much greater sense of control, but it's fragile. If someone develops symptoms but they've been working, they've seen a lot of residents, they've had interactions with other staff members, and potentially, without those safe behaviours of wearing masks and physically distancing over the lunch breaks or tea breaks, that's a risk of spreading it to a number of staff. That's what happened earlier on in this phase, but there's really good control in a lot of settings now. But it only takes a delayed diagnosis, working with very mild symptoms for a few days, for that to mean 10, 15, 20 cases pop up in a day.
Once we start accepting return travellers again and we restart that hotel quarantine program, what kind of a role are you expecting and also hoping to play in that reset?
Well, I'll always be engaged in the sense that the hotel quarantine program's working with Alfred Health around the infection prevention and control and PPE standards that apply in those settings, but anything that's required from my public health team in terms of expert advice and the risk management, and there are national conversations around best practice quarantine programs. We'll continue to look at what the future means for hotel quarantine, whether there's a risk stratification, whether there are any tweaks that we can make around that. Clearly there are some countries where there's such high prevalence of COVID that you've got a 5% or more chance of developing illness in hotel quarantine. There are other places like Western Pacific nations where there haven't been reported cases at all. They're probably COVID free, so we can potentially manage them differently.
The inquiry heard that you didn't play as much of an active role as you also would have hoped. I guess, are you hoping would you provide proactive feedback or proactive advice as opposed to waiting to...
I'm not waiting. I'm embedded, intrinsically looped in now. So I'm on the state control team with all of the secretaries of our major departments involved in this response. We discuss this through that state control team meeting on a daily basis.
Today, I think is when Victorians can no longer wear face shields; they have to wear masks. Can you explain why that's coming into?
So face shields basically protect the eyes, but they stop at about the chin level. There's an open space you can breathe in through your nose and mouth, so they don't provide protection from transmission other than that eye protection. So in addition to wearing a mask, they've been used in hospital settings, they've been used in other settings to give an added level of protection by protecting the mucosa of the eyes. But as protection alone, without a mask, they don't do the job. So we're basically saying you have to wear something fitting that covers the nose and mouth. That's what the standard required is, because we know that that's really what's needed to protect from transmission.
Just a quick one from Premier.
Just checking, with the face shields, is that today that comes in? I thought it was another week.
I thought it was 2 weeks.
I thought it was 2 weeks.
I think it's 2 weeks. I think there were, on the day, I think there was a bit of confusion about whether it was 1 week or 2. I think I'd said 2 weeks, which was actually the media release may have had 1 in it, but it is 2 weeks.
1 more week.
Correct, yes.
Thank you.
But do it now.
Yeah, but please do it. Please don't wear a shield now, or if you do, wear a fitted face mask as well.
As we go towards COVID normal, have you sort of started any discussions about interstate travel and when that could resume going forward?
No, but we'll, at the appropriate time, we'll engage with other states who are close to us at the moment, albeit some of them are opening up gradually to regional Victoria. As I've said a number of times, the best and most important thing that we can do to allow Victorians to travel throughout the country is to get our case numbers as low as possible. So that's why these numbers are very pleasing, and the fact that the strategy is working. But of course, whilst many of us would like to travel to different parts of the country, none of those experiences would be better than travelling within Victoria. So of course I'm obliged to recommend to people that when we get that ring of steel is no longer there, holidaying in regional Victoria would be an absolutely fantastic thing to do. And we'll have more to say about supporting tourism operators and supporting families to not be within 5Ks, but to stay local.
Premier, you made it clear towards the end of last week that you were supporting an Indigenous woman to replace Jenny Mikakos. There were 2 Indigenous women in that race. One of them, Prue Stewart, has worked for you and was seen as having your backing. I've been told by senior members of your Socialist Left faction that 32 out of 36 Public Office Selection Committee members were supporting the other female Indigenous candidate, Sheena Watts, who's now been pre-selected. It's been put to me that your support for Prue was the kiss of death for her. That shows that there are some people in your own faction who are pretty angry with you, doesn't it?
Well, as I said yesterday, there are a number of people who their stock in trade is business as usual. I'm not surprised that they're angry that I called upon the party to not miss this moment. I'm thrilled, absolutely thrilled to think that when the National Executive deals with this process tomorrow, we will have our first Indigenous female Member of Parliament in our caucus. That's a really fantastic thing.
But it was the one who you weren't backing.
Well, I wouldn't be assuming these things. One shouldn't believe everything one's told, Rachel, by people who it seems have nothing better to do than to be, making these sorts of calls. Good luck to them. Seriously, I got involved because I felt I needed to, and I'm thrilled with the outcome, and that's what leadership is all about. If others are less thrilled, then I really can't speak to that. I really can't speak to that. I'm absolutely thrilled with the outcome. It's a fantastic outcome, because at the end of the day, as I said Thursday, Friday, whenever it was, as a Labor government, we've very clearly established that when we say it, we get on and do it. So we don't just talk about justice for Aboriginal people and a true partnership. We've taken the biggest steps of any jurisdiction in our country. And I just thought this was an opportunity where the party needed to do exactly the same thing. Actually deliver, actually live your values. That's what's happened, and it's a fantastic outcome, an absolutely fantastic outcome. And once the formalities of the National Executive process are finished, I'll have more to say about the person who will be our newest member of the team.
Are you disappointed that Prue didn't get up?
Well, there's processes, Rachel, and candidates put themselves forward. It was a very, very good field. And the outcome is a very good one that I'm particularly pleased about. Any other issues? I'll just say, if you've got symptoms today, even the mildest symptoms, don't wait to get tested till tomorrow. Don't wait till tomorrow to get tested. Please go and get tested today. Thank you, and we'll see you tomorrow.